Thanks for staying with us. It's Tuesday. We deal with some medical issues. So according to reports, Nigeria has recorded 36 new confirmed cases of monkeypox in 1 week between August 22nd and 28th. This brings the total number of confirmed cases since January to 277, with 6 deaths. The latest situation, which was released by the NCDC, that's the Nigeria Center for Disease Control, noted that more than 50% of the cases were recorded among men. Joining us on the show now is the public health expert, Dr. Folashade Olusheye. Welcome to the show, madam. Good to have you.
Thank you. Good morning. Good morning, Nigeria.
Monkeypox. You know, when I hear monkeypox, because I don't really know what it is, so I just think, oh, maybe like another smallpox thingy that, you know, we'll get over it. But then I started seeing visuals in the last 1 week, pictures of monkeypox cases, and I'm thinking, oh my God, this is not as small as we thought it was. So let's even start from the beginning. We know of smallpox, we know of chickenpox. Which is monkeypox? What is it exactly, and how do you contract it?
Well, monkeypox is just like smallpox. In fact, there are so many likeness to the two: smallpox, chickenpox, and the smallpox, monkeypox, and chickenpox. They are all viruses that are sort of related. Yes. The thing about smallpox was that it has been eradicated, but by many things that people could not see, they started seeing monkeypox, which has always been there before. And because they are viral infection, their spread is almost like same. But as it was said, monkeypox, the origin has been said to be from animal. Monkey, dogs, all those. And for interaction between man and woman, maybe because man go into the forest to hunt monkey, or some of us, we do animal food and all that, we bush meat and all that. So the pox can now infect man. But we have man-to-man transmission when we have interaction, as we speak with each other, we sleep with each other, we live in the same house. As health worker, we manage patients, and we don't know. The patient goes home or the health worker goes home. And so that is why there is now man-to-man transmission. The origin of monkeypox is said to be from animal.
So when these animals, are they sick animals, or it just naturally occurs in animals?
Well, just as man can have viral infection, animal too can have viral infection. So it may be that when animal and man interaction takes place, the animal was already sick with the pox. Okay. Or maybe when man goes hunting, the animal already has the pox. And just like any viral infection, it could be asymptomatic. Even the animal may not exhibit it. It may be the man that touches it that exhibits it. Or it could be that even the animal has it, and the man decides to still undo it.
It's just, for me, it's worrying that we just left the one of, we're still managing to exit coronavirus and the COVID-19 challenge, and all these animal-related diseases that they say actually is more of laboratory creation than just direct contact from animals. But in Nigeria, the cases are coming up, and my worry is it curable, like completely curable, in a way that if somebody contacts it, you're not scared that you might just pass on from it?
Well, we cannot say it's self-limiting. That's the thing about most viral infections are self-limiting. But we have to understand the underlying condition of the person that comes in contact with the virus. Most infection, your body will fight against it. But when you have some compromise in your immunity, that is when you will now have a severe form. So you could actually become exposed to monkeypox and don't have symptoms. Within 3 to 20 days, you could show symptoms, and the symptoms will vary from headache, fever. Most of the time, it's usually fever. And if your body is able to fight it, it will stop at that level. But if it cannot fight it, it will go on to rash. And so the pathognomonic, or what you will see that you say this is monkeypox, is the rash. Once you don't have the rash, you may have it, you might have come in contact with it, but you did not develop the disease that is called monkeypox. But by the time you develop monkeypox, you have the rash, and the rash is usually in stages. It comes like a pimples on the face, and later it starts spreading, and the size starts increasing until you have what it looks like a boil. It has vesicle, and inside that vesicle is the virus, which you can now shed on your cloth, on the beddings, on the table. And somebody else comes in contact, somebody comes to pick your cloth, or you sleep together. And it is said that it is also on the genitalias. One thing that
Father, that thing is on the genitalia?
Yes.
The spirit.
So that means you could spread it during sexual intercourse. It is a possibility.
What would you still be doing when you have that kind of...
No, you may not know. You know, at the early stage, it's usually just a mild. And it's, the fact that you have fever does not mean that you will not have the urge to have.
Until that urge cannot come.
So when the urge comes, when the urge comes, you can actually spread it.
Wow.
But one thing that is outstanding is that most people that have it, they are people that have some sexual behavioral changes. Like what we call men sleeping with men, or bisexual, that is, they sleep with both men and with women. And the thing about them is that their immunity is usually affected. So maybe that is why we have it more
in men.
And that is why it is spreading. Because believe you me, things are happening in our society.
The word of God is true. So I wanted to go spiritual. Let's talk about prevention, because as I'm listening to you, I'm thinking, I've seen poxes as a child in chicken pox, and I remember my siblings all having it, and I didn't develop symptoms fully because my mother just did something preventive. So what measures can you put in place if the moment you spot, now that we even have it, that your child is feverish?
Okay, what we encourage is that if there is fever and you are suspecting that it's likely to be, isolate, then you watch. We encourage that you improve good nutrition, so that you can boost your immunity. But in area where the people are actually very high risk and all that, there is vaccination. Although the vaccine is expensive and it's not readily available.
In our country?
In our country, you have to pay a lot to get it for now. So what we still encourage is that once you suspect it, isolate, eat good food to boost your immunity, and watch it. If it comes out that it is rashes, we encourage people to go to the hospital.
You know, this is where we need our rich folks. You know, abroad, we have so many foundations. Some sick come and say, you know, I'm bringing in monkeypox vaccine to the country. I bought him 1 million doses. But no, rather than buy a Bugatti, a Biburati, a
But let me tell you, when they even bring the vaccine, I remember when the government brought a lot of COVID vaccine, some of them actually expired.
People didn't take it.
Because people were not going out to take it.
Imagine.
Even up till now, if you look at the population, how many people have gone to collect their COVID vaccine?
Exactly.
And we have the COVID vaccine. So it's not a matter of maybe people are not ready. But when it comes to monkeypox vaccine, although we have vaccine, it is not readily available. It is expensive. But the good thing about monkeypox is that it can run a self-limiting course, and within 2 weeks, 4 weeks, you will be okay.
Let me go on a quick break. When we come back, we continue this conversation. Stay with us. We'll be right back. Thanks for staying with us. We're still learning about monkeypox. And I was going to ask you, so once that rash comes and you have one people, how do you ensure it doesn't spread to be 2, 3, 4? What can you do to quickly stop it at that moment?
Truly, you don't really have much power to prevent its spread, because it is already in your blood. It's a, like I said, it's a lymph node or your immunity status thing. So your immunity has already been compromised. It's low, and that is why you have the rash. And so the rash keeps erupting. So
it can come up anywhere.
In fact, the rash of monkeypox come up even on the palm.
Wow.
That's why, even on the head, if you look at those people that, if you on the scalp, everywhere so it's usually from head to toe, but it usually starts from the face. So it will start with one, then it starts spreading, then you look very like a tiger, you look very scary, and on the scalp, then the hand, the skin, the genitalia, it goes down. So once it starts, it keeps, and it's usually at different level. As I told you, it starts as a pimple, then it becomes very deep-seated, like a boil, like a small boil, and it's painful and itchy.
It causes body pain.
All right.
It causes body pain.
Okay.
And lymph node, you know, all those lymph nodes in those areas become enlarged. Those things that you call petele and all those things, that you know is very painful. So it causes.
All right, let me ask you a question. Go ahead.
Yeah. Okay, so what happens if you suspect that you've come in contact with someone that you can do so that you don't have the pox?
Okay. Now, somebody has monkeypox, and you know, the first thing is you try as much as possible, improve hygiene. That is what every one of us we have to do, because we don't know who is who. Washing of hands, very important. Avoid using somebody else's towel, clothes, beddings, and all that. And if it happens, you try and isolate. Maybe it is husband that comes down with it. You may need to isolate. Maybe stays in the room. And if there is a very intense symptoms, we encourage them to go to the hospital. Because now we say they are suspected. It may even be suspected. Because not until when you confirm it. And to confirm it, you need to take swab off. Okay. So that, because I remember about a month ago, we had a patient in my hospital that had a very serious rash. Everybody came running around. Hey, we have monkeypox, we have monkeypox.
And it wasn't.
I look at it. It was actually scary. It was. So I took the picture. I sent to my colleague. I said, it looks like. He said, okay, we should send the patient. So we sent the patient to IDH. But when they did the test, they admitted it was chickenpox. So ordinarily, we felt it was monkeypox because it was actually very, very similar. And that's why I said chickenpox, smallpox, and monkeypox, they look very much alike. But the difference is that when I now look again, looking at what monkeypox and chickenpox, I remember that the man, though it was up, down, it was not really like boil. I was not too deep-seated.
Okay.
Like that of monkeypox. But you know that it is quite different. It's just like you saying a snake is poisonous and the one is not poisonous.
It takes
You
run from everything.
You run from everything now.
Yes.
But how are you as a doctor protecting yourself? Because I know that many of our medical professionals tend to get exposed to these things in the line of work.
It's true. We are exposed, but you cannot run away. We still encourage ourselves to do what we call the preventive care, control, use of face mask, avoid contact as much as possible. Now, we don't allow patients to sit too close to us because sitting too close, the closeness, and as much as possible, clean surface, wash hand, use face mask. Those are the only way. And if you have it, you stay away from work. Because I remember that particular patient was in our hospital a week before then. He had fever. So when he came back with rash, we had to go and look at the file of the doctor and who saw. And I said, please, you need to look out. Check yourself because you saw the patient when the patient came in with fever.
What's the response like amongst governments now? What preparations are in place? Are we treating it as we treated COVID or?
No. For now, we don't police like we did for COVID. We encourage people that have any ailment to go to the hospital. And if we suspect it is chickenpox, we educate them. And we encourage, monkeypox, we encourage them to go. IDH, mainland hospital, is still the place where we can get tested. There they can take sample, they can test, and within 48, 72 hours, the result is out. So you can actually know what to do. And as I said, monkeypox for now does not have a definite treatment. So what we still do is we isolate, we encourage the close contact to watch out, eat well, improve hygiene, And as I said, if your immunity is good,
I need to ask this.
if your immunity is good, you may come in contact with it.
And it will not.
That does not mean that you will come
For
down.
someone who has it and maybe is isolated at home, do they have a bath?
Yes, you can. They do take their bath. It doesn't.
Can they use sponge?
They can. It's very painful, so you will not want to touch it with any. It's a painful lesion. Very painful lesion.
But you have to have a bath and wash yourself with soap.
You can have your bath. I remember those ones. It will help you prevent bacterial infection.
Okay.
So you need to.
There's this antiseptic they used to put inside water.
Savlon, Dettol. You may use it. You may take your bath with antiseptic solution. Maybe just during that time. Because, you know, we are encouraging people to have their...
So really, you just need to... So during that period, is eventually to go by itself.
Yeah. It's self-limiting.
So you have to just keep
wait it out and
wait it out.
Right.
Within 4 weeks...
Let's consider our ginger,
4 weeks, so
turmeric,
Let me
garlic.
take this call for a wrap-up.
No, within 4 weeks. It may not take 4 weeks. That's why it is still individual.
Right.
Somebody will have the rash within 2 weeks.
Let me take this question from Sheon. Good morning, are you there? Hello, good morning, Sheon, are you there? Okay, we lost the call. So as we wrap up on this, I think I'd like you to give a final word to those who, now we know that it can be contracted, especially those that can be passed from family to family, from your bed sheets, from clothes. So we know that now. But how do we ensure, can kids get it? Can children get it? Or because they've been vaccinated, they are prevented from this? How come? Because we thought that we took vaccines when we were young. You think that this vaccine would cover us from this?
Everything completely.
Well, from the study, children less than 8 years, probably because of all the vaccines, the childhood vaccination, you know, there is a way maybe it rubs over each other to protect them.
Yeah.
They are not likely, but never say never.
Yeah.
Okay.
But after 8 years, you could have it. Any of the people could have it. So we still encourage, please enjoy, make sure you eat well.
Yeah.
It doesn't have to be expensive.
Yeah.
Because you don't know what you will meet in the bus. You don't know who you will meet in the road. So encourage people to eat well. And if you have any symptom, please go to the hospital.
Yeah, so on Twitter, Lastborn says, please, what kind of food does one need to eat to boost the immune system?
You eat fruits, vegetables, and eat everything edible in moderation. That's what I tell people. Avoid junk food.
Yeah.
Because they don't build your immunity. Once you eat well, whatever comes your way,
eat
Body
it.
can fit.
Okay, Nima is happy.
Eat amala.
That is
eat amala, eat ewedu,
And cow leg soup.
All right, thank you so much, Doc, for joining us this morning.
Thank you.
Appreciate
Thank
it.
you for having me.
Let's go on a quick break. When we come back, on to another subject. Stay with us. We'll be right back.